Thanks very much, Carol. Now, magnets are proving to be a new attraction for use as a medical treatment. For years, therapists have used magnets to treat a wide range of conditions like sports injuries and migraines.
Indeed. Now, doctors at the Maudsley Hospital in London are experimenting with magnets as a way of treating depression. And we're joined by Dr. Declan McLaughlin, who's leading the trial at the Maudsley, and Lillian Curtin, who's a magnet therapist. Dr. McLaughlin, what are you actually doing?
Well, we're employing a technique called transcranial magnetic stimulation. And what we can do is use this technology to harness brief magnetic pulses to induce secondary electrical activity and target this to specific brain regions.
So what does that actually mean? That you're actually placing a magnet in close proximity to a bit of the brain?
Yeah, what we use is a handheld coil, which is about, say, the size of your hand, and there's a sweet spot towards the center of that which can be applied to over certain parts of the brain surface. And then we can create a brief magnetic pulse. This will induce a secondary electrical field in the brain surface beneath it, and that will activate that region of the brain. So in depression, we know that there's certain parts of the brain, for example, the left frontal lobe around this area here, that are underactive, and then when people recover from depression, the activity in this area returns to normal. So what we've been doing is employing this technique to stimulate that part of the brain, and in the hope that this will have an antidepressant effect.
Does it work?
Yeah, there's certainly quite a lot of evidence now over the last 10 years or so from studies in the United States, Australia, Germany, and Israel, that this does have an antidepressant effect. The question is how good that effect is, how long it will last for, and I suppose how best to apply the technology to elicit this antidepressant effect.
Lily, you're already using magnets to treat your patients. Are these your props that I've been handed?
Yes.
Okay, I better give them to you then. How you can use it on Michael. How exactly does that work?
There's got a lot to cure.
This is guaranteed to put a smile on anybody's face. It's a Magnessage. It lengthens and relaxes muscles. It'll put a lot more blood flow into an area where there's trauma. So may I borrow your knee?
Be my guest.
Are you going to roll your trousers up?
No, I think we can leave it as it is.
Will it bring a smile to my face? Or?
Well, you tell me. How does that feel?
Well,
does it tickle?
well, yes.
What it's doing, it's going to reduce...
It's a knee trembler.
It's a knee trembler. It's going to reduce a lot of the acidity in here, which is generally the cause of a lot of pain in people. And by lengthening and relaxing muscles, we can then make sure that they're prepared for any activity they want to do. So if they're a sporting person, they're not going to pull a muscle or damage themselves. And this is much better idea, so that people, if they need to stretch, they can do it far more quickly this way.
And what's this for?
Don't stop.
You can do it to me later. There we are.
Well.
What's this pad for? I've got this as well.
This is great. It's also be a lot of use in sort of Declan's work. If people have very bad sleep, they tend to feel bad. They get up in the morning, they look in the mirror and they go, did I actually go to bed last night? This is going to help people sleep a lot more deeply. And so they get up in the morning, if they put this in their pillow, put their head on it, all they've got to remember to do is go to sleep.
It sounds a bit like leeches, doesn't it, in a sense?
Leeches?
No,
I don't think so.
You know what I mean? It's a kind of,
you say
it sounds a bit quacky.
No. Basically, the magnetic field will help lower the circadian rhythm of the brain. So if the brain's really busy, then you're not going to go to sleep properly. And this will help reduce that activity. And if you sleep better, batteries are boosted, your healing is much improved.
Yeah. Dr. McLaughlin, just very briefly, I mean, presumably the technique you're using replaces something like electroconvulsive therapy, which was a much more violent way of trying to deal with the same sort of condition.
Well, ECT is probably the single most powerful antidepressant treatment available, but because of the nature of the treatment and its side effects, what we're keen to look at is, would TMS be a suitable alternative to ECT? And in fact, we have a trial underway which is funded by the NHS to compare ECT directly with TMS.
It's early days, I'm sure, but is it looking hopeful, Martin?
Well, we've recruited nearly 60 people or so over the last 18 months into our trials for TMS and depression, so the studies are sort of halfway through, so it's still early days.
Yeah. Oh, well, let's keep our fingers crossed.
Thank you both very much indeed. Don't run off that magnet. I want to have a go later.
Lillian, thank you very much for joining us today.
Pleasure.
You're the Queen of Magnets, I believe.
Well, I don't know about Queen, but I shout very loudly about them.
Now, this is a very serious form of treatment.
It is a serious form of treatment, but it's nice because it's totally non-invasive and very safe. And you can have them in your bathroom cabinet at home, and you don't have to rush to the doctor and things like that. And it's brilliant at getting rid of pain and getting rid of injuries very quickly.
OK, Lynette, now these aren't the magnets that people are used to seeing, the little horseshoe magnets. Obviously, we're talking about some serious technology here. First of all, what have I got here?
There you have probably something that Lindsay might have been using, which is an elbow wrap. And if I can have your elbow,
Sure.
we would pop it round there and attach it. Whoops.
I tell you,
This
this is
is
a lot less
smaller
painful than
one.
the treatment I got yesterday.
And there you should be able to, it's a bit of a small one on. You could move your elbow, you should be able to play tennis. And inside that, just so that people could have a much better look, you've got magnetic pads here, and they've got 2 magnets in. Now these magnets are going to penetrate about 6 inches into the area of trauma. So very quickly you're going to neutralise any of the lactic acid or the tissue trauma that's built up. It's going to bring a lot more blood flow into there.
So just really, in very simple terms, the magnet just causes a little reaction within the area, draws out the bad stuff, leaves in the good stuff. Is that what we're talking
Absolutely.
about?
It gets rid of the pain by neutralising the acidity, which is what pain is, basically.
Do you have to believe it before it'll work for you?
No, not at all. That's some of the best patients of mine are the biggest skeptics. And the nice thing about these is they're very, very strong. They're therapeutic magnets. So you'd like to give me your hand.
Yeah, absolutely. Which way up?
Doesn't matter. There we go. That is the power of a therapeutic magnet. It will penetrate 6 inches into the area, so you can actually, as they can see, you've got it on both sides, and that's going to work very, very quickly. So you could put that on a knee, you could put it on an elbow, anywhere.
I mean, I suppose a lot of people are kind of probably quite negative about it, but I mean, it's been going a long time. Its roots are in ancient civilization.
Well,
right?
go back to Egyptian times. Cleopatra wore a magnet, they believe, on her forehead to enhance her beauty. You had one of Queen Elizabeth I's physicians who tried to get his patients to eat iron filings and then put magnets on the front of their tummies to undo strangulated hernias. So for centuries, we've been using magnets.
Bill Clinton also uses magnets.
Yes, he does.
What are you laughing at? That's accidental. I picked that up, sorry.
I know, but it's guaranteed to put a smile on your face, rest assured. If you put your hand out, this will emit an electromagnetic field.
Right.
So it can treat, you know, it's very good for warm-ups for people who are doing tennis, if they want to, so their muscles are prepared, so they're not going to injure themselves. It gives them much greater flexibility, much greater, magnets will strengthen a muscle because it's got a lot more blood flow in it, and this is going to do that very, very quickly.
So this will work in the, I have a bad hamstring at the moment. If I kind of...
Slip it along your hamstring, and I think you'll find that not only feels good, but you'll find that in a minute you would be able to straighten that leg a lot more easily.
Really? And can I go and pick up one of these? Can I go and buy one of these?
Yes, you can. Yes, you can.
Really?
Absolutely. If you come to somebody like myself, you would be able to buy one, or any accredited therapist, or Norstar makes them. They're excellent.
I tell you, it's actually quite enjoying this.
It is. As I said, it's guaranteed to put a smile on your face.
I hope you don't mind. I'm just going to spend a little time here doing this. Maybe it's best we have to carry on with the weather. I tell you,